Today we're tackling some of the toughest dementia-related symptoms and behaviors: agitation, aggression, and sexual expression. These moments are challenging, but they're also symptoms of brain change, not intentional actions. So stay tuned and we'll get into it. Hi, Dr. Lakelyn here. Welcome to Caregiver Chats. I'm a gerontologist and caregiving advocate for Home Instead, an honor company. I'm so glad you're taking the time to join me. These conversations are a space for learning, reflection, and support. And I invite you to subscribe to Caregiver Chats on Apple, Spotify, or wherever you get your podcasts. And don't forget, I love hearing from you. You can email me anytime at caregiverchats@homeinsteadinc.com. Today's episode touches on some of the toughest moments in caregiving. When your loved one shows signs of distress, aggression, or confusing changes in intimacy. These behaviors can be upsetting and even frightening, but they are symptoms of dementia and not signs of intentional harm. Back with me today is Carrie Aalberts, also known as Dementia Darling. If you missed our first conversation in episode 26, the 10 resources every dementia caregiver should know, be sure to go back and give it a listen. Carrie brings such clarity, warmth, and real-world insight into this conversation. I'm thrilled to have her back with us, so let's dive in. Hi, Carrie. Welcome back. I'm so excited to have you with me again. This is going to be such a great conversation.
I'm so happy to be here. Thank you for having me back. Anytime to talk with you is such a treat.
Oh, I totally agree. And before we dive in, if our listeners haven't met you or heard of you before, can you tell us a little bit about yourself? I just admire all that you do in the dementia space. And so I would love for you to share just a little bit about you, your background, and your Dementia Darling work that you do.
Thank you so much. I appreciate that. And to just have you say that is just like, oh my gosh, so kind. But I am Dementia Darling, as you said. I go by this persona. And what has led me to this is originally my grandma was living with dementia and my dad was her main family caregiver. And so that started when I was 6 years old. So I kind of always had that in my life. And then it stuck with me, apparently, because when I went to college and I was able to focus my studies in gerontology, the study of aging, it changed my life. And I got my bachelor's and master's focused in gerontology. And through college, I was working at an intergenerational adult daycare center.
Amazing.
And it was the best. And it just completely changed my view on the life to be lived, living with dementia and the joy that's there. It was the most beautiful time. I could talk about it all day. But after that, I went on through different, assisted living and memory care and then back to adult daycare. And the consistent theme was that family caregivers were so socially isolated. They weren't being told thank you. They weren't being seen in their daily life. And that didn't sit right with me. And I felt like, okay, I keep meeting these people and it's amazing. I get to meet them in real life and hug them, but how can I touch more people because there's millions of people like this? And so I started my Dementia Darling Instagram in 2019, and now it is my full-time job.
That's amazing.
It's amazing. This is the world we live in now. You can make your own jobs apparently. But I, was just sharing what I knew and just love and caregive, cheerleading for these caregivers. And it's led me to being, full-time where I'm educating professionals and family caregivers and just being able to pour my heart into this community. So that's a little bit about how I got there and why I'm Dementia Darling.
That is so incredible to hear your story and to learn how you got to where you are. And as a fellow gerontologist, it's so crazy that you said gerontology changed your life, because I say that to my advisor that welcomed me into the gerontology community. I'm like, this industry changed my life. So if anyone listening, quick plug for Gero, get your gerontology certificate, take a course. It will be so worthwhile. The need is so great. And as you said, there's so many family caregivers who are caring for a loved one, supporting a loved one, living with dementia, and they often feel so alone, or they're dealing with some really challenging changes in their loved one. And that's what we're going to tackle today, kind of those more challenging quote unquote behaviors. And we'll talk about why we say quote unquote in just a minute. But these are really hard things to witness, to watch your loved one go through, to have to handle. And sometimes you feel like, gosh, I don't know where to start, or am I the only one dealing with this? And I think it's safe to say, no, you're not the only one. And we're so glad that you're here to listen to this. And I just look forward to kind of unpacking some of these challenging symptoms, behaviors with you today, Carrie.
Me too. Me too. Thank you for talking about this, because every time this is brought up on a post or in person, they're like, I feel like I don't get enough time to just talk about this and vent, because this is one of the hardest things, but they're dealing with a progressive disease. So you don't even have time to stop and really understand what's happening sometimes, because you're already on to the next thing, right? You don't even have time to process or vent sometimes. So we have to take the time to really understand this whenever possible.
Oh, absolutely. Well, and we're going to talk today kind of about 3 categories of these symptoms, behaviors. We're going to talk about agitation, aggression, and sexual expression / intimacy. And so before we kind of dive into each of those, Carrie, I would love to just chat a little bit about this brain change. There's so many terms in our industry that get used, behaviors or dementia-related behaviors or symptoms. So let's just explain that maybe a little bit to families, and why we like to use air quotes, and how maybe we can help families reframe their perspective on what's happening.
Absolutely. So yes, I know you're my people when you are doing behaviors and air quotes. I'm like, you get it. And so this is, I think, our way of changing the language. We're trying to shift the language from this behavior. This is their choice. They chose to behave this way. What a negative connotation we have put on this, especially because, I'm coming from I've seen this in a professional field where, it's in the note taking and it's like they refused because of this behavior. And it feels very pointed and it feels like we are shaming when, hello, their brain is literally changing.
Yes.
They do not, they're not choosing to say, I'm going to be really agitated today and piss off everyone in my life. That is not a choice.
No.
And, this is happening, specifically when we see agitation and aggression and these sexual inhibition changes, that's happening when our frontal lobe in the front here is being damaged. So when that brain change is happening in the frontal lobe, that dysfunction is happening, that's going to start to change and affect, our different inhibitions and how we maybe our personality and just how we react to things. And that's why, you hear the frontal lobe, so frontal temporal dementia.
Yes.
So that's what, with that type of dementia, that cause for dementia, you see changes in personality first. Yeah. Because that's what's being damaged first, is you're not the hippocampus where it's the memory. It's going to be the frontal lobe. So you're going to see personality changes. You're going to see that agitation, that apathy. All of a sudden, you're a person that's always been interested in your life could care less.
Yeah, that's hard.
Oh my gosh, the hardest. And then your person was always so sweet, and now they're cussing, and now they're saying things that you're like, I didn't even know they knew that word. And so it can be very, very jarring. But we need to, when we say behaviors, quote unquote, it kind of puts this connotation that it's a choice. And I just want to say it's not a choice. It is a change in their brain that they do not have control over. Mm-hmm. And when we remember that and remember it's not personal, it is not personal. It can really help us in the care we can provide. And I'm not saying this is easy for family caregivers to say, oh, it's not personal. Okay, I'm fine now. But it's a good reminder for us to remember that. And so when we say behaviors, I like to push it towards, this is a symptom of brain change. Right. This is not a choice. Symptoms are not choices that we have. Exactly. So I like to say the symptoms that are happening and instead, but unfortunately it's kind of been labeled behavior. So that's why we use those quotes to kind of signify we're going to change this. We're moving towards person-centered language. Yeah. Absolutely. Making sure that we're focused on the person, making sure we're reminding ourselves this symptom, this behavior is related to the dementia, not
not something that they're doing on purpose. They're not trying to get under your skin. And so I think that can be a helpful reminder. But as you said, it's hard to like make that switch in your brain as a family caregiver. And it might take time to accept that day by day. One day you might accept it. The next day it might be extra hurtful. And just know that that's okay. And that's normal. That's a normal part of the caregiving journey. And speaking of terms that we use in the industry,
Yes.
agitation, there's been a lot of interesting discussion around the term agitation because it can mean so many different things. It can be like an action like pacing or rocking or gesturing or fidgeting. It can be that restlessness. It can be that repetition that shows up. So when we use the term agitation, it really is like an overarching term for a lot of different things. Do you have anything to add to that?
No, that's
Carrie?
exactly. I mean, and your person, like agitation can look different for other people. Absolutely.
Right.
And that's why we see, sorry to throw out FTD again, but that's why we see with FTD, those, big behaviors of, like ripping nails and picking at their skin, because that's another form of agitation, trying to just do something. And, that irritability. I mean, there's so many different things that we can see in that for sure. Different emotions, right? But just if we think about the agitation, just them being in a state where they're, anxious, maybe, the anger, the just confusion is kind of overloaded, and that leads to that. Yes.
Yeah. And I think a lot of times that agitation, it can be triggered by a lot of different things. And maybe we'll go into triggers here in just a bit.
Yes.
But the other symptom we're going to talk about is aggression. And that can show up verbally and physically. And so again, that is so hard, especially as you mentioned, if your person was so like mild mannered and now they are cussing or hitting or biting. I mean, those are things that can happen. It won't happen in every situation. But when it does, that is so hard.
Oh my gosh. Yes. And it's just, it adds so much to the overall, experience you're having, because you're trying to figure out, is my person normal? Is this something that people experience? Because you don't necessarily see this out and about. You don't, people kind of hide away when these things happen, right?
It's true.
And unfortunately in communities, if we're not, if we're not with a team that's really well trained to do this, you might be in a position where they're like, you have 30 days to get out because we can't handle this.
Wow.
And that's another set of like, you're scared because you're like, who can handle this kind of behavior if you're not aware of the trainings out there and the things, that people can do to help with that. But when you're isolated in your home and you're in a point, I mean, I've met way too many, wives that are now scared because they're overpowered by, their husband who can't decipher that, they're trying to help them. And, they think maybe there's someone, a stranger in their home or, and they're up against this, and it can be very scary. So I want to validate it can be very scary, and we need to make sure we're taking care of our safety, not just our person's safety in those situations.
Absolutely. Yeah. Well, and I think what can be really hard is when the person does still have their physical strength.
Exactly.
But they're progressing through the disease process. Their brain is changing, and these aggressive behaviors come out because, again, they're still very physically strong. And whether it's a spouse caring for another spouse or an adult child caring for a parent, I mean, that can be really challenging. And I think if you're listening and that is your situation, this is a sign. Like maybe get some more education, get some help, maybe start to look at your options, because that's probably a situation that is not going to be sustainable for your well-being in the long run.
No, and it's not safe. I mean, I don't want people to wait until a crisis occurs. If you do not feel safe, if you think, this could escalate, do not wait for it to escalate. And I know sometimes that can be a privilege to be able to get help right away and all the things. But if we just try to start reaching out for help and having backup in some sort of a way, having someone that you can call if you get in a situation, where you need support. Unfortunately, sometimes, people have had to call the police on their person because they cannot do it themselves in these moments. And I just, want you to be able to keep yourself as safe as possible. But I know, again, this is your person and it's scary and you're like, they're not going to do that. And I don't, it's so complicated. So much grief is involved. So I just really want to validate that. But please know that you are important and you need to be safe just as much as your loved one.
Absolutely.
Yeah.
Absolutely. Well, and we'll continue to share some tips and resources as we go through our time together today. But then the last kind of symptom category that I wanted to cover that not a lot of people are willing to touch on is, I like to call it sexual expression. I heard you call it sexual inhibition, but what I hate to hear is sexual inappropriateness because, again, the brain change is happening. Yes. The person doesn't in the moment recognize that what they're doing is inappropriate. So I like not to use that term. I like to use sexual expression because, just because we have a diagnosis of dementia doesn't mean our need for that intimacy goes away. We're still human, and so it just might be that they are misinterpreting a situation, which can be very uncomfortable. I don't want to sugarcoat that.
Absolutely.
But I think that, again, we need to reframe, okay, this person's not trying to do it on purpose. They're maybe misunderstanding. And so we'll be talking about maybe ways to handle that. But any other thoughts on that topic? Because it's kind of racy to talk about, but we need to because it's a reality for so many people.
We have to talk about this more. This is the thing that, I bring up in any professional or family situation. They're like, thank you. Can we talk about this? And I don't know the answers and this is why I want to talk about it, because we have to help each other figure out the situations we've been in and how we've been able to get through them, with dignity and with all the things that we, really want to support the person in. So I think this is so important to talk about and to just always reframe, as you said, this is an expression. This is something that is normal, just like having a bad day as a person, grieving as a person. That does not go away when you have dementia, when you have brain change. You still have these human experiences, and that is one of them, the sexual expression. And when we do reframe that, for family and staff, that they're not doing it on purpose to make you uncomfortable. Yeah. We'll go into this later, I'm sure, but I just really like to reframe it as, think about the context. I would think, like, as a professional caregiver, I go in, I just hugged this man because I hug my, residents and we're close, we're family. And now I'm taking him into his room to get undressed for a shower. Think about the context there. For someone who is trying to take all their information from what's happening around them because they do not have the ability to really see the full context of things anymore. They're taking in what's happening around them. They are able to respond to their world by taking in all the sensory overload around them. So that's how they navigate their unknown world, is what is happening. And so if I'm, if they're in their mind, they're in their 30s, 40s, whatever, and I'm coming in there and I'm saying, let's get off our clothes. And, I'm being so kind and maybe, and I just hugged him outside of his room before we came in when I came on my shift. Context, that kind of makes sense. I'm sorry. I just took this guy in his room, taking off his clothes. What did that mean in his earlier life? What would that have led to earlier in his life? Probably with his wife. So thinking about those things. And that's another thing. I know it can be, I had a woman, her dad hit on her the other day, and it's like, and she was like, oh, dad, that it's me. He's most likely in an age where he's not a dad yet. So he's not even going to relate to that. He's like, this is my girlfriend, this is what I'm 20 or whatever, and she's in my room. And so we have to kind of put it into perspective and give them that grace, because it makes sense. Most things, when we look at it through their perspective, makes sense. Yes. It really does. We just have to let go of our reality. And that's the hard part.
That is so hard, especially if you're that daughter that just got hit on by your dad. You're like, oh gosh, what is happening?
Yes.
But you also might look a lot like your mom did at your age. Exactly. So again, from his frame of reference. But it also, I think, goes to the point where, there might be an unmet need for that person where they want that intimacy. And we just have to find maybe a new, more suitable outlet for that. Maybe it's, rubbing their back regularly or holding hands with someone, or just finding ways to provide that comfort, whatever that maybe desire is, or maybe provide them with private time of their own. And so again, we'll go into some more of these tips, but when we reframe it or we look at it from their perspective. Okay, is there this maybe unmet need that they're trying to express or communicate through these things that we in our reality feel is inappropriate or so out of context? It can help us in our caregiving journey, maybe just let go of our reality a little bit, step into theirs, and hopefully find a way through. And
yes. And as you said, yeah, it doesn't make it less uncomfortable, especially as family. And I want to validate, I've never cared in that sense for a family member. So I just want to say, I do not have that experience. And I want you to know that that is so incredibly difficult. And I will never say that I understand what you guys are going through. And I just thank you for showing up and learning and getting through it, because I know this isn't easy. Before we move on, though, I just wanted to put out there. So what we're talking about are BPSD. So you might see that is behavioral and psychological symptoms of dementia. So BPSD, and the three things we've been talking about, agitation, aggression, and sexual expression, those kind of fit under that. And they say up to 90% of all people living with dementia will have at least one of these experiences over their progression. So you're going to see, you're going to deal with this most likely in different ways. Maybe not the three things we're talking about, but there's depression, there's apathy, there's anxiety, there's all these other things that fall under that, hallucinations, delusions, the anosognosia and confabulation, all of these things fall under that. And then it's kind of different for each variation of dementia. But just so you know, these are, those, even in the name, it's behavioral and psychological, but they're symptoms of dementia. Yes. These are symptoms of these different diseases. Yeah, these brain changes.
Thank you so much for helping to clarify that. And that was going to be my next point is it's not a one size fits all situation. No. Yeah. And as you just mentioned, there are some common symptoms, meaning that, we see it across the board commonly, but it doesn't mean that, your loved one or your person is going to have every single one of those, thankfully. Thankfully. So when you are trying some of these things, these tips that we're going to maybe talk through today, it might not work for your person. It might not work today, but it could work tomorrow. Yeah. Or it might work today and not work tomorrow. And so it's kind of this trial and error. And sometimes you can kind of identify some triggers or patterns, which can be helpful. And there's also a lot of what we call in our world non-pharmacological approaches to care, which just means they're not drugs. They're just approaches to the way that we care. And then sometimes, though, there are some underlying medical issues that might pop up that is maybe causing some of these symptoms. So, Carrie, maybe before we dive into the tips, do we just want to touch on a few of those maybe underlying medical conditions? And one that we know is so common are UTIs, urinary tract infections. Those can bring about some symptoms very suddenly that are kind of fall into these categories. So maybe let's chat about that for a moment, just so that families know, like, if this is all of a sudden coming out of the blue, UTI might be the culprit.
Absolutely. We have to talk about UTIs more and how they are not the same as when you're younger getting UTIs at all. Yeah. They can actually be deadly, unfortunately, and, lead to sepsis. And it's just very scary. And it can happen, like you said, very fast. So before you even started the UTI thing, absolutely, it's the majority of these behaviors, quote unquote, these symptoms are them communicating something to you. So yes, they could be all of a sudden agitated out of their mind because they're trying to tell you they're in immense pain with a UTI. Yeah. And so when we just say, redirect and keep moving, that is not the way to go. That's actually dismissing them, right? So we want to try to figure out what's going on. So yes, with the UTI symptom, it can really come on in this sudden confusion, and not confusion as they've had with their dementia, that you've seen, but major confusion to a point where you're like, they're completely different. Like they've almost skipped a couple stages in their dementia overnight. It can be very jarring. And same with it. you can see this increased agitation and aggression, maybe really intense paranoia all of a sudden, or hallucinations. Maybe they're not sleeping, or they're not really eating because they don't want to even put anything in their body because of this pain. They're just trying to communicate with. Also, if you see a lot, like randomly, if you are seeing increased falls can be a big indicator as well that they're off. So, this can happen again, like overnight. And I'm noticing as I'm talking to professionals, Lakelyn, I don't know if you've seen this, that it's getting harder for nurses to get the antibiotics they need, because UTIs usually don't show up until like 5 to 7 days after on a test. So they're already like deep in, and then they have to prove to the doctor, I need this antibiotic, but it's already maybe to a point where it's not going to be effective, but it doesn't even show up in time. It's very difficult to deal with, especially if we're not understanding what they're trying to communicate to us. So sometimes when we see these things, all of a sudden it's good to, try the UTI test as fast as possible. And then if you're seeing this still in 5 days, do another test. But that it can be a big barrier for this to get treated, unfortunately.
Well, and I think too, anytime you're seeing these changes in the person you're caring for, start to document, know, what you're seeing, because when you do go to the doctor, they're going to ask you questions. When did you start noticing these symptoms change? What are they experiencing? So, to your point, yes, get connected with your doctor or the person's doctor right away if you think that there's a UTI or other unexplained pain that they're experiencing, but then also be documenting, because they're going to ask you those questions, and it's always better to go in prepared than to try to think back, because caregivers are already juggling so much, to try to think back, okay, 5 days ago, was that when the symptoms started? So that can be just a helpful tip as you kind of navigate some of this. And then, there are some medications that can help address symptoms related to dementia. And so if your loved one is experiencing prolonged agitation or aggression, you do want to share this with the healthcare provider, because for that individual, there might be options. Of course, I think in our field, we prefer to use the non-pharmacological interventions first, but we also know for some, these treatments might be effective. They might not be right for everyone, but that's something you can certainly discuss with your healthcare provider. So I'd like to throw that in there as well. No,
thank you for saying that. Specifically, we see depression so intensely in dementia, and we often don't think that we can, give them a depression medication, and it can be the biggest game changer ever for some people. So just to be aware of those things if the non-pharmacological, isn't working for someone. But just a couple of things about UTIs. Can I add three how please. To prevent? So we want to make sure we stay as well clean down there as possible. So this is why I'm so impressed with the Depends that are coming out that literally have sensors in them to tell you when the person is wet. And it will send to your phone, and hopefully these will become more and more, normalized and just easily accessible for caregivers. But it'll send a notification to your phone saying, 30% full, wet, Depend. So they're not going to be sitting in a wet Depend long. So we want to be checking on a regular basis, at least every 2 hours, to make sure they're not sitting in just super wet, because that can lead to UTIs for sure. And before, after we change them, before we put on a new set of underwear, we want to make sure we're dry. Sometimes we're going so fast, we put it right back on and they're wet from the wipes we use. So we're still wet. And that can lead to some infections as well. But keeping the fluid intake is really big. We want to make sure that they're staying hydrated. And I know this is hard, especially if our person is scared to go to the bathroom because they've fallen before. So they're trying to avoid the bathroom. And that leads to UTIs because they're not drinking their water, all the things, or not recognizing their cup anymore. So don't offer the drink to your loved one. I just learned this from Adria Thompson of Be Like Care, who was just on your show. Instead of, saying, do you want a drink? Just handing it and saying, take a sip. take a sip. Like, do not even give them the option. And it feels more natural to them because most of the time they're going to probably say no just on default. So just take a sip. So keep trying, take a sip, and get creative, utilize things that have a lot of foods that have a lot of water, cucumbers, melons, different things like that can also help, or making their drinks more appealing or putting them in different glasses. I had a woman who would only drink out of a wine glass. Give her water all day in a wine glass, So get creative.
Yes. Yeah. I had a client where we used Dixie cups and lined them up, and they would take shots with the Care Pro. And they just had a really, a giggle about it every time. But it got her drinking, her needed fluids for the day. It's like whatever works, whatever glass that they're going to drink out of, let's lean into that and use it to our benefit.
Yes. No, I love it. Yeah. You got to get creative.
Well, I love that we're kind of on the tip sharing train right now. So maybe let's dive into all three of those areas of symptoms and maybe talk through some of the tips or strategies or approaches that families can take. Or again, I know we talked about a lot of times maybe it's that the person's trying to express an unmet need, or especially as communication skills decline as they progress. Sometimes it's just very frustrating. They cannot communicate in the way that they once were able to, and that causes a lot of, irritation, anxiety, agitation.
Too.
Yeah, exactly. If I'm trying to tell you something and you can't understand me, yes, I'm going to get frustrated. So I think sometimes if we approach it from, okay, what are they trying to tell me? What are they trying to communicate? And kind of putting on the little detective's hat and getting to the bottom of it can be helpful. But would love to hear some additional thoughts and tips from you, Carrie.
Yes. And so valid. Yes. It's so hard to really take the time and see what is happening here, because it could have been something that happened the night before that, led to this aggression later on in the day. It could be, there's so many things that can be triggering your person's behaviors, quote unquote, these symptoms. So, as you said, the communication is huge. What are they trying to say? It could just be, yes, the frustration of, I can't tell you I'm hungry. I mean, that's huge. I can't tell you what I need. And so you're just doing all the things, to figure it out until it kind of ends. And, absolutely, as you said, taking down notes, because sometimes it can take a long time for us to find the trigger. Sometimes we don't find it even. Sometimes, we can't figure it out, or it just seems like it's just random. So that's what makes this job so hard, right? And as you said earlier, where it was like, something can work one day or 1 hour and then it doesn't, it's already the hardest job on earth. And now add that this tip might work, it might not. So that's very difficult. But yeah, so this is super hard. So we want to at least, as a Montessori professional, not stop right away and say, okay, what can I do to right away redirect them to something else, to just get away from this uncomfortable moment for both of us. We want to stop and validate them. We all want to be validated in life. When you're upset, do you go to someone and you want them to be like, it's fine, get a cookie? No, you want to be, I say, do you want to be hugged, heard, or helped? Have you heard that before?
No, I haven't.
Oh my gosh, I love it. So when someone's upset and they come to you and you say, what do you need from me? Do you want to be hugged, heard, or helped? And they can choose, because sometimes you just want to be heard. Sometimes you do want help. Sometimes you don't. Sometimes you just want to hug and that's it. So I try to think, what does this person need to feel validated from me? I don't care if they need to be heard and it makes no sense verbally to me. If they're getting it out and saying something and that's good for them, that can maybe be the release they needed, just to feel heard. And you go, yes, I'm with you. I'm on your team. Absolutely. You're right. And you agree and you validate their feelings. Because sometimes, if someone's trying to exit seek, let's say, and go because that was the time of day they usually made dinner for their beautiful family. And so they feel like they need to get out of here. If we go, oh, Susie, it's fine, let's go get a cookie, that's not validating or fulfilling her need. She needs to be, we need to see, okay, well, this makes sense that she would, in her past routines, this is what she would do around this time. So let's try to fulfill that need in the sense of, can you help me get ready for dinner? Can we do something? Can you tell me what were your favorite meals to make for your family? And we can try to make one of those this week, really trying to meet them where they're at. Because again, as I said earlier, everything makes sense. It really does. Everything makes sense in their world, and it makes sense to them. And so it's us that we have to kind of catch up to them. So meeting them and not necessarily just going right to redirection. And I know we don't always have the time to do that. So just, being aware, not every time you're going to be able to stop and be this great detective for an hour. I get that. But when you can, do it and see what you can find along the way. And, we're seeing that a lot of triggers are really environmental. There's a lot of environmental triggers, specifically, when we see in community wise, how overstimulating it can be. That can be, with people all around, music on, a TV on, people walking by, that's a lot. And that can lead to these different forms of communication they're trying to get out, because they're like, I'm in my living room. Why is this going on?
Why are all these people here? Turn down the music.
Exactly. And that makes sense, right?
Yeah.
Or, if you're at home and your person has maybe, and this can happen in the community too, I'm not saying just at home, but maybe they've been sitting all day or they haven't really socialized. And so by the end of the day, they have all this energy that they haven't been able to get out. And so now they're agitated because that's the only way they can get out their energy.
Yeah.
So something like that is something we can give them. We can try to keep them busy during the day and give them things to do and get their energy out so they can have this, routine. And then they're tired at the end of the day, like they would have been in their, routines before dementia. So things like this, if we can see overstimulation, understimulation can be causes of these needs to express because, they're bored or just like, oh my gosh, I need to get this energy out.
Yes.
Right.
I know. How many times do we just need to go for a walk and burn off some steam or go for a drive? I think those things don't go away just because we have a diagnosis of dementia. So maybe you do need to build into their routine, like a walk around the block or something of that sort and see, does that change how they experience those symptoms over the course of the next few days. Yes. It is that trial and error and just kind of seeing what works one day and if not, then you course correct and you try something else.
Exactly. And it's like, oh, are they, okay, they get really agitated on Tuesdays at 2. Oh, that's after the PT left. That's when, the physical therapist leaves every Tuesday. And then I see that after, or, they're not sleeping on Sunday nights and that leads to aggression later on Monday afternoon. There's things that we can look at. So environmentally and what's going on around them can have a really big impact.
Oh, for sure.
And I know these aren't strictly tips, but just things to think about. And one thing I really love is the color theory in dementia care, because color can actually play a big part in how we react to things as well. And so if you think, if you have things that, if you have a black mat on the floor,
yes,
that might look like a hole to someone living with dementia. And that might create fear, agitation, anxiety, because they think they might fall. And maybe that will, lead them to not leaving their room, which can lead to other, forms of, these behaviors they're trying to get out to you. So really looking at what is their environment telling them and how are they reacting to it, because those could be the triggers that we're trying to look for as well, if that makes sense.
Yeah. Oh, for sure. I like how you've kind of bucketed these, it could be these unexpressed needs, this desire to communicate, but they're frustrated. Maybe they can't, or it could be environmental, could be things in the environment. It could also be certain people too.
Yes.
I think that's a hard one to talk about, but there might be certain family members that for whatever reason, or even caretakers within the care setting, that they just don't click with or that make them extra anxious. And I think that happens to all of us in our lives. We don't get along with everyone we meet. And so I think that, when we talk in the home care world, sometimes it takes a few times of having a few different care professionals come to the home to find the right match. And so, but in a family setting, it's like you can't just swap out one family member for another, unfortunately, in some cases. Sometimes we wish we could. But if someone is helping with like bathing, for example, and it's not going well, maybe try someone else in the family, or maybe it's time to bring in a home care professional and let somebody else try that activity. So sometimes it could be related to the person. And so if you're seeing a pattern, or every time that PT leaves, or every time so-and-so comes over for a visit, they are more agitated, that could be just a clue. Okay, maybe we need to switch up the schedule, or just when that one person is there for their weekly visit, we also play soothing music that they know that they like, or something, So I think that it's okay to, if you recognize it's a person, that also is kind of the stem, because that's a normal thing. I mean, you're not unique in that situation.
No, I have been the person that was triggering to someone because I looked like someone mean from their past. And they did not like me. And they did not want to be near me. I was like their bully in high school or something. I forgot what it was. And it made complete sense, like once I figured out from the family. And so, and not to take it personal.
Right.
And it's so hard. And it's so hard as a family member. Absolutely. And another thing that I've noticed in my work, it's actually, I think, been the most prominent environmental trigger is the TV. And that's why I'm such a fan of like Zinnia TV, because
such a great resource.
Oh my gosh. Because I'll never forget. I mean, I had a woman, I came into work and they had played Titanic at 8 a.m. And because someone asked, and I'm like, you don't always have to say yes to those things. And so now for a week, even it was adult day, so she would go home too. So at both places, she thought everyone was drowning for like a week. That stuck with her because it was so traumatic. Yeah. And then I've seen that while watching the news when, there was a huge storm, and it stuck with my person because he had lived through a big storm. So he was like stuck there, and it was horrible. Same with, but then it can even be things you don't think. Because I had a woman who, her and her husband would watch The Office every night. All of a sudden, The Office was triggering to her because she thought when they bickered, it was him bickering at her.
Oh,
and it took him a while to figure that out. And then finally he did. And he goes, this is why she's been so upset before bed. Wow. And so they had to change what they watched. And it makes sense because sometimes we get to a point where we can't decipher. And if we're watching something scary and we thought that just happened in our living room, how horrific.
Absolutely.
Yeah.
And I think that is an important kind of point. Like as somebody progresses through the disease process, because all of these types of dementia, we don't have a cure for them. Hopefully someday in our lifetime we'll see it. But
we will.
I'm hopeful, but things change. And I think that sometimes that's hard to accept. Like if you, your loved one always loved baseball, we're in kind of baseball season, and they loved going to games. That might not be something that they can continue to do because it might be overstimulating. So you might have to start watching them on TV. Yeah. And even that might get to a point where they get, too riled up, or just it might not be as enjoyable for them, or they lose interest. And, I think that sometimes that's hard to see your loved one go through those changes and not be able to do those things that they once were able to do. But you have to meet them where they're at. And remember not to take it personally. And, if you're able to step into their reality, meet them where they're at, and provide, that support that they need in that moment, that's what's going to, make you a successful caregiver in that moment. But it doesn't mean it's not hard to watch. But I think that that's something we need to keep in mind. We always need to be kind of recalibrating based on their needs. And from day to day, they might have a good day where they can do a lot. And then they might have a day, just like all of us, where they're having a rough day and they just need maybe a little more downtime. And so you kind of just have to adjust to those needs as they come up day to day.
Yeah. And find new joys. There's new joy to find. When we look at, we're talking about this person-centered approach, when we're looking at what is still there, not what has been lost. What is so still important there. And I know this is such a hard mindset shift. I know. But when we do it, we don't live in that negative space as much of, oh my gosh, we just lost another thing. It's like, okay, we still have all these things here that we can work with, and we can have fun, and we can find joy and love together in this moment. And I just think being mindful and being in the moment with someone living with dementia is such a bittersweet gift we get from dementia, is the beautiful, moments of just pure connection. Because it's not about necessarily everyone remembering what just happened. It's just about being in that moment together and being connected and being here on earth. And that's what life is about, is being mindful. And unfortunately, people, that might not have brain change, it's hard for us to be mindful. Yes. It's hard for us to be in the moment. And so to look at them and say, wow, they can help me be more in the moment in my own life, and I can just be with them, is something that is beautiful. And I like to focus on that.
That's such a good point. Yeah, there is a lot of joy, and there is, if we can, meet them where they're at. I love that.
We have to find the joy. It's hard.
Do.
Yeah. It's another thing caregivers have to do. I know.
Adding to their to-do list.
Adding to it.
Well, I'd love to talk about aggression a little bit more. Yeah. We've talked about how it's so important to keep, yourself safe as the caregiver, care partner, keep the individual safe. And so if, we're starting to see this aggression start to happen, I think sometimes trying to intervene early on before it escalates, that can be helpful. And there's a number of ways you can do that. And it really kind of depends on the person. So maybe we can talk a little bit about that. But then I'd love to talk about, okay, when it has escalated, what can we do? Like, is it just, removing yourself from the environment, making sure they're safe in maybe a room by themselves, stepping out and away, let everyone kind of cool down and then reapproach? What are some things, Carrie, that you have heard from the caregiving community that kind of work in these times when maybe I think probably talking more about the physical aggression, because the verbal, while it's very painful and hurtful, maybe isn't as jarring as the physical aggression that we sometimes see.
Absolutely. And this is so hard, you guys. I know. We all know this. This is just so hard.
I know we talked about how oh gosh, do we even have good tips on this? I'm I think we do have some good tips, but it's just so hard.
It's so hard, and it's different for everyone, and it's different every time for everyone, right? No same thing is going to keep happening in most situations. It's going to be a little different each time. You're going to always be on your toes. But one thing, as you said, if you kind of get in the beginning, or as it's kind of ramping up, or even if okay, they really get this way in the afternoon, quote unquote, the sundowning hours. So what can I do in the hours beforehand to maybe help lessen this or even avoid it altogether? Sometimes we can. Some days it will, some days it won't. And so that is the calming environment. I would always try to set up my residents who have that difficulties in the afternoon after lunch, that, we got out energy in the beginning of the day. We did exercises. We got out energy. We ate, and now it's rest. We need to rest. Calming music, calming, smells in the air, the aromatherapy if you need, having, things of comfort to them, not just, not just you think this is comfortable. What is comforting to them? Whether that be, your grandma always watched, a certain, golf or whatever, putting that on, or putting whatever it may be that's calming to them. Lean into that, having their comfort items around them, being in their favorite chair, making sure that they've been fed well, and, they've gotten out some of that energy. And sometimes that relaxation can help lessen into those hours and can kind of set them up for success. But again, not all the time. If they're going to be trying to get out the door, maybe going on a walk beforehand to fulfill the need to leave. Can help sometimes. And just that, so much agitation can come from just, needing to get out that energy. So, being as routine as possible can help a lot, and just following that routine. And so once you get into the groove, again, I see for a lot of people, it's just helpful to get up in the morning and, after they eat, is to get that energy out. Usually we're we're better in the mornings to do those kind of things. But your person best. When it's starting to escalate, one thing to always do, and I was not good at this, is to approach with calm confidence. I would approach with, oh my God, like hug me, oh, it's okay. And then they would feel that and they're like, oh my gosh, I'm not calm now. You're not calm. And so try, and I know it's hard when they're like yelling for you to be like, it's all good, but the vibes matter.
They feed off of your energy for sure.
100%. And if you're super like nervous and like and scared, they will feel it. And it will escalate it, honestly. And this took me such a long, and this is why I got hit so many times in my work. Like I've gotten decked because I went to the person thinking, like I got it. And it's like, no, if they're, physical, please stay distance. Do not go towards this physical, aggressive person. Keep your distance and stay calm. Stay calm.
Yeah.
Focus on their emotions, not the facts. Like if they're saying things that make no sense, don't try to fight first off with that. It doesn't matter. It does not matter what they're fighting you about. You don't have to be right. I'm sorry if you haven't gotten to this point yet, you're never going to be right. I'm sorry. So just accept that now we're in their world and we're going to focus on the feelings, not the facts. So that's what I always say is just look at, okay, obviously they're very agitated. What can I do? Oh my gosh, absolutely. This is very frustrating. Even if you don't really know what's going on, validating that this is so frustrating. Absolutely. How can I help you? I'm here. I'm on your team, and just reminding them I'm here for you. Like you are safe with me. Those words can be really helpful in those moments. And again, keeping your distance. Keep your distance. If your person is getting physically aggressive, please. And I know it can be hard because you want to offer that physical comfort sometimes, but just be aware of that. And then also a tip that's really helped me in these moments is I've seen a lot of aggression and it's led to the person, it's come from like a hallucination or a delusion of, something's been stolen or something is wrong. And sometimes they just want to talk to an authority figure, or they want to talk to someone that they in their mind trust. Like, sometimes they don't believe you until it's from a doctor. Or from, you know what I mean? So I used to have in my phone a friend who would be 911, who would be the police. And they would talk my people down that needed to get out. Like, I need help from the police. And they would be able to get that out verbally. And that helped me a lot in these agitated situations. Like I've been pinned against a wall because they were so upset, physically agitated, but I was able to get my phone out and call, and that completely diffused the situation because they felt heard.
That back to your 3 H's. Sometimes you just want to feel heard.
Exactly. And don't be like me and always assume they want to be hugged because you might get that. But I hope that helps a little bit. Just
for sure.
Calm and validating the feelings and not being like, you shouldn't be upset. Nothing happened, or something like that. That's not going to be helpful.
Yeah. Sometimes you have to apologize. You have to say like, I'm sorry. I can see you're upset. And even if you did nothing wrong, and sometimes it's just that, like you said, like that validation, being heard, can be so helpful. Gosh, we are having such a great conversation. And I definitely don't want to cut it short before we have time to talk about this sexual expression and some tips for that. And a lot of times we see this come about in times of personal care. So showering, bathing, toileting, and again, back to your example earlier, we have to kind of put ourselves in their shoes. And so sometimes I mentioned maybe trying a different individual. Sometimes, like I know in the home care world, if we had a female care professional caring for a male client, sometimes that's where we would see those sexual expressions come out. And we at times would bring in a male care professional instead. And that just changed the dynamics and all of that went away. So, things like that you can definitely try. But if you're the family caregiver in the moment, I think, staying very matter of fact about the activity and kind of explaining what you're going to do before you do it can kind of make it more of a formal kind of care situation. But would love to hear from you, Carrie, any other tips on how to handle these types of situations when they come about.
First off, I'm so happy you've been able to switch out for a male caregiver, because I know that is very few and far between.
Yes.
And
It's not always an option.
Yeah, not always an option. I know. And yes, as we said earlier, context, and makes sense. So just validating that in your head too, like, okay, my person isn't, naughty or dirty or anything like that. It is totally makes sense. So just putting that out there as well again. But I think it's very important, as you said, to remove yourself. If you're at home and you need to step out and try again, do it. Those resets are, again, sometimes a little bittersweet gift we get in dementia, is we get to do redos. And so sometimes we just need to step out and give them space. But of course, we're only going to do that when we know they are safe, and you can leave the room when they're safe in their room alone, of course. But that is a huge one. Sometimes we both just need that separation for a moment to breathe. And then I think it's really important too, if you think back to their routines, maybe, we don't bathe at night anymore, because maybe that was kind of the routine with your wife at the end of the day or something. So maybe instead we do morning showers, or, we just kind of change up, the time of day can help as well, that I've noticed. But as you said, I really like, telling them what is going to come next is huge. It's, it takes away that surprise. Sometimes you can redirect in these situations. And I know I've been saying, don't redirect, but in these situations, you can set them up for success in the sense of, putting on their favorite music, not romantic music, but let's say, some Elvis songs they really like or something. And you can be engaging with them in that way when you're helping them in these situations by singing together, or, just trying to put the focus on something else that brings joy can be helpful. Yeah. And when we bring in music and bring in little things like that, being silly together during times of routines like this and times of care tasks, it can, it brings a lot of engagement into our lives when we're not just doing the care tasks together, but we're engaging and we're singing and we're being silly and we're talking about how, how the different soaps smell, and we're having an engagement. We're not just, doing this uniform thing together, and, it can just kind of help with where the attention is going. I feel like when we can focus on other things.
Yeah, absolutely. Well, and I think also, if like not in the let's move away from maybe the personal care, and maybe when the father makes an advance on his daughter, or a care staff member or something, how should people kind of approach those situations? I think, I've heard some say, like, being kind of just like firm and matter of fact and saying no, thank you, and then kind of walking away can be helpful in those moments. But any other thoughts in those times as well? I know it can be so challenging.
It matters it's just different for each person, because sometimes if you're really, like, okay, no, that can make them upset, and
that's so
make
true.
them feel shamed. So we want to be careful with that, but that is true. Absolutely. If you're uncomfortable and you're like, no, that's totally valid in those moments. But I think sometimes, that can feel a little shamey. So we can say, I like to say, oh, thank you, but I'm your friend. Let's go do.
Oh, that's a great
and that's
way.
when you redirect, like, oh, thank you, I'm married, or something, like joke about, or like, thank you, I'm good, but let's go on a walk. Or that is when you are redirecting, right? We're not going to be like, what's the trigger here? I think we know what the trigger is. So we want to just kind of redirect in those moments specifically. And if you feel uncomfortable and you are able to leave.
Yeah.
If they are safe, especially if you're visiting someone at a community, leave. You are not a bad person if you need to leave early, or if you even show up at the door and you say, I can't do this today. You are valid.
Yeah.
You're valid. So allow yourself the freedom to say, that was a little too much for me today. I'm going to leave. And just, but again, really trying not to shame or say or make it feel like it's their fault. So just keeping a calm tone and being like, no, or like, we're good. I'm your friend, but thanks.
Yeah.
Thanks, because sometimes if you're like, dad, no, they're in a timeline where they're not a dad and that's not going to land.
Right. Exactly.
Things like that. So, but changing out the person whenever possible with the professionals as well can help a lot. If there's something, if there was something inappropriate, okay, let's take a break and have a new face come in 5 minutes and try again. And if it's consistent, maybe we need to think about the routine as this is probably not the best time of day, or maybe something triggered this earlier in the day where it was just one of those days where this was the focus, it just, that's another one where we have to really see if the consistency of it. But I wish I had better things to say, but it's really, being as kind as possible and keeping everyone safe. And it's so hard. It's so hard.
It is. Well, and especially if you're caring for a spouse and that part of your relationship is starting to change.
Yes.
I think just redefining for you both what intimacy looks like and finding just new routine in that. And even maybe for a family member, like more holding of their hand regularly, or like, giving them a little neck massage. And if you find that those are leading to the sexual expressions, okay, maybe back off, but maybe there is that need that they're trying to express, or maybe there's a different way that you can now just meet those needs in a way that makes everyone feel more comfortable. So, again, it's such a hard topic and it's not this one size fits all, but I think, if you're starting to see patterns of this agitation, aggression, sexual expression, and you are a family caregiver and you're trying to do it all alone, this is probably a sign that maybe we need to look into getting some help, or having another family member come in to provide the primary caregiver some time away, a break, because it's these types of symptoms that I hear from caregivers all the time. And I'm sure you do too, Carrie. These are the symptoms that lead caregivers to burnout. And that's the last thing we want for caregivers to burn out. So whether it's, having a family meeting and saying, look, this is getting to be too much, I need other family members to chip in, or, hey, it's time to start looking into home care professionals, time to reach out to like a home instead or other home care providers, or this is becoming unmanageable at home. The safety is outweighing everything else. And so we need to start looking for memory care options. I think that, these are things that caregivers should start thinking about. And like we mentioned earlier, before the crisis happens, to start having these conversations and getting the help and support before you're at crisis and are like, okay, something has to change. Sometimes you don't always have the luxury of choice in those crisis moments. So having those conversations, along your caregiving journey as you're starting to see these things unfold, that can be helpful.
When they say those symptoms are the number one cause for finding long-term care. So number one cause for families to say, okay, I need help, is these BPSD, these symptoms that we're seeing that just become way too difficult to manage. One person, we are not meant to do this alone.
Yeah.
We are not. And unfortunately, that's how it's kind of been built in society, that you can do this, you've got this, and you have to wait until it's too hard and you're, so burnt out, you're losing your mind. No. And whenever we can find the support, we need to reach out. There's nonprofits that you can get on lists for, respite hours in some areas if you qualify. There's respite grants. There's, there are people that are out there to support you. But unfortunately, we have to find them and we have to get a little crafty. But absolutely, this is not something anyone should be handling alone, especially with someone they love. And, we need that support. It's so heavy. And so, thank you for saying all those things. It's just so important to educate ourselves and know that even though we feel alone, we are not alone. I promise. And I know that's annoying to hear sometimes, but you're not alone. I promise.
Yes, it's true. And especially as you're trying to navigate these really challenging symptoms, you're not alone. Other people are going through this. And I think connecting through support groups can also be super helpful if you're not plugged in. Carrie and I in our last episode did the top 10 dementia care resources every caregiver should know. And we talk about all of these kinds of supports. So I would encourage you to go back and listen to that one if you're at a point where you need resources, because plugging into these types of things is going to be so, so important for you on your caregiving journey. And you can learn so much from other caregivers, just like hopefully you've taken away a few things from us today. But, follow Carrie and her Dementia Darling Instagram account and all of her socials, because she has so many great tips. And just continue to reach out for support, because you're not alone. You don't have to go through this alone. And Carrie, I'm just so grateful that you're willing to tackle some of these tough topics. I know we feel like we didn't have all the answers, but hopefully we at least gave people a place to start today.
Yes. And I'll keep studying, and then I'll come back when I learn. I promise. This is one of my biggest things I'm trying to figure out. And we need all the tools in the world. So I will report back. I promise everyone.
I can't wait to have you back. A repeat guest, because you have so much great knowledge to share. And I just appreciate your time today and all that you're doing in the space, and for all of the light and joy that you bring to dementia care, even when it can be really hard and heavy.
It's really hard. Thank you so much for having me. And thank you, caregivers. You're amazing. Keep going, and know that I'm cheering you on all the time. Same with Lakelyn. I know we're both here cheering you on.
Yes, absolutely. Thanks, Carrie.
Bye.
A sincere thank you to Carrie for joining me again and sharing her expertise with such honesty and heart. I hope today's conversation helped you feel more equipped and more compassionate when facing some of dementia's toughest moments. Remember, these behaviors or symptoms are not your fault, and you don't have to handle them alone. Whether it's reaching out to a care professional, trying new strategies, or simply giving yourself a break, every step you take matters. If you found this episode helpful, please subscribe to Caregiver Chats, leave a review, and share it with another caregiver who might need support. And if you missed our first episode with Carrie, episode 26, the 10 resources every dementia caregiver should know, be sure to go back and give it a listen. You can always reach me at caregiverchats@homeinsteadinc.com with your thoughts or questions. And don't forget to follow us at Home Instead Inc. on social media for more caregiving tips and updates. Thanks for listening, and please remember to take good care of yourself while you care for others. Caregiver Chats is brought to you by Home Instead. If you're looking for in-home care to support you on your caregiving journey, please visit homeinstead.com to learn more.